The first step in the 5 A's model of smoking cessation is to ask. Discuss the patient's smoking behaviors using the medical history form. Make sure to inquire about the kind, quantity, frequency, triggers, and history of stop efforts. The clinician would initiate by saying, let's start by discussing your current tobacco use. How do you participate in the tobacco use? Can you share your smoking habits and any challenges you've faced in trying to quit? Here, the patient would share their experiences, whether they use cigarettes and smoke a pack a day, or if they use hookah and only use it socially, at parties. They also may reveal their interest in quitting. The second step is to advise. Encourage the patient to completely give up smoking in order to establish a long-lasting lifestyle of improvements. Clinical experiments have demonstrated that a clinician's advice to modify a patient's behavior must be unique, strong, and personalized to the patient. The clinician would say, based on your responses, it's clear that quitting smoking is a common goal. It's crucial that we have a clear conversation about your smoking habits. Quitting smoking is a non-negotiable priority of your well-being. The evidence is indisputable. Continuing to smoke poses severe health risks, and it is within your power to make a positive change. Think about your life, your loved ones, and the future you want. Picture the benefits of a smoke-free life, from improved health to increased energy and longer, more fulfilling future for your family and friends. This is about you and the life you deserve to live. Patients may then discuss their main motivations and concerns for quitting. The third step is to assess. Using the stages of change concept, determine the patient's readiness to change. This method of staging a patient allows the clinician more effectively to tailor the course of action for the patient. For patients in pre-contemplation and contemplation stages, the 5 R's model is applied, whereas those who are ready to quit receive counseling with motivational interviewing techniques such as open questions, affirmations, reflective listening, and summary reflections. A clinician would start, to personalize our approach, let's assess your readiness to quit. On a scale of 1 to 10, how confident do you feel about quitting, and what factors contribute to that confidence level? The patient would then express their confidence level and discuss contributing factors. The fourth step is to assess. Help the patient develop a strategy for action. At this point, the clinician can provide the patient with materials tailored to what their needs and precise referral details for programs and assist people to quit smoking or self-help resources, such as websites or phone quit lines. At this point, the clinician can also help the patient determine a date for quitting, and to talk about Zyban and or nicotine replacement therapy. A clinician would say, now that we have identified your readiness and concerns, let's explore strategies for quitting. Here's a pamphlet on smoking cessation programs and a list of self-help services. This includes telephone quit lines and websites. Take a look at these and see which one resonates with you. Let's also consider a date that gives you enough time to prepare mentally and emotionally. How about setting a quit date within the next 2 weeks? This allows us to work on strategies leading up to that day. The final and fifth step is to arrange. Set up a clinical follow-up appointment for the patient. It is crucial that the patient understands that their clinician will be there to monitor and aid in their development. The clinician may start as we wrap up, let's create a plan for you. I want to emphasize our commitment to supporting you throughout this process. Establishing a clinical follow-up is crucial for us to track your progress and to address any challenges you may encounter. I'll arrange the follow-up appointment, and in the meantime, don't hesitate to reach out if you have any questions, or if there's anything specific you'd like to discuss before our next meeting. Your progress is important to us, and we are happy to support you every step of the way. Next time, the patient may come with individualized plans, triggers, coping mechanisms, and support networks. The script provides a general framework for a tobacco cessation discussion with using the 5 A's model. Facilitators and clinicians should adapt the content to the specific needs and dynamics of their patient.